I'm Dr. Anagha Joshi. I work at the Roslin Institute as a researcher. In 2012, I got a Chancellor's Fellowship to start my own research group in bioinformatics. After starting my own group here, within a few months, I got pregnant. And it was actually quite a shock to me because it was unplanned. But when I told it at work, I was surprised to get such a positive support from the director and the head of the department that it kind of initially lifted my spirits and I started seeing it as a positive thing. During the time of maternity leave, I could actually come back once or twice at work, and that was quite useful because for 4 months being completely out of research puts you, it's very hard to then get back and start working. So I used those 1 or 2 days to give some courses for the PhD students, so I could get back slowly into my own work. Then once the maternity leave period was over, I applied for 6 months of working part-time because I was still breastfeeding during that period. So it was nice to come back to work slowly, but also at the same time care for my baby. And it was really nice that flexible working is considered these days. Once I came back to work, I was still breastfeeding, and then it was really nice that there was a special room allocated for breast pumping the milk because I was pumping the milk to give it in the nursery. And this made my life much more easy because it's not comfortable to pump your milk in the toilet, and there is no other place in the building to pump the milk. And the second important thing was to go to the conferences because as a researcher, attending some scientific conferences is a part of my job. And while breastfeeding a baby, it's most parents actually do take their kids, but it's an additional expense. And somehow at Roslin, they started put aside a small fund for a carer to travel with you to the conference so that you can take care of your child while attending the meeting as well. And I used this scheme 2 times to go to 2 meetings, and it was really a great help. I mean, most parents do it, I mean, spend their own money to do it anyway. But this is just the recognition that actually we do care and we do understand from the university side that you have to deal with the child care while you attend the conferences. So I really find it very supportive.